Some of our adult colleagues or in other specialties sometimes think it's pediatric, it's just a slimmer down or smaller version of what the adult guys do. It is very different in pediatric neurology in particular, because for pediatric neurology, we tend to see more developmental issues. We tend to see more genetically or congenital abnormalities. Obviously, if you have a child that has a specific neurologic issue, the pediatric neurologist is kind of your ideal person to see. And we want to and we can deliver and offer basic child neurology inpatient, outpatient services. Common things that we'll see are kids with headaches and migraines, kids with developmental delays. Sometimes you see kids with movement abnormalities, sometimes behavior issues. So we try to attack each of those problems as best we can. And we definitely do mostly a lot of child neurology as well. And so we'll build on that as we kind of expand the program. Epilepsy and epilepsy surgery is kind of more what I'm geared towards. So we don't have the staffing or support from other services yet to get there, but that would be our goal. And so our goal eventually is to offer a robust epilepsy program. When you make a decision whether you want to work with kids or work with adults, you kind of know immediately. It's a gut feeling and how you feel. And for most of us, we generally get along with kids pretty well. We kind of understand them, and we have our heart set on trying to make an impact early on in life. Obviously, we all can make impact throughout stages of life, but there's something to be said about seeing a child. Really, there aren't much pretense to a child. What you see is what you get. You know, they're very honest with you. There's no second guessing about their motives or anything. And so that's kind of refreshing to see. So that's one layer that you don't have to work through that you would have an adult that's had so much of life go through them, and now they're kind of going through a different prism. Their views are kind of skewed a little bit. So I think children in general are much more compliant than adults. You kind of suggest something, they can really do it. The issue is more kind of getting the families to kind of come on board. So that's more of a challenge for us. On the inpatient side, you see, well, the sickest kids, this is kind of the worst day for the families, for their you know, it is really the worst day for them. And so you kind of take that approach each day. And so it may be a good day for you, a good day for someone else, but it is really the worst day when they're in the hospital.